Hi, this is Suzanne Clegg, and
Jonathan Gold.
Jonathan has agreed to shoot this video with me to describe his experience with his mother working with energy medicine with her cancer. So, Jonathan, why don't you start by telling us how we met and telling the audience how we met and all that.
We met Suzanne several years ago when my mother was battling a very severe case of shingles. Mm-hmm. And we went to several specialists who treated her for shingles with little, if any, success. She had allergic reactions to the prescription medications they prescribed, and her pain was getting worse by the day. And we were basically told by these doctors that my mother would have to learn to endure the pain for however long it would take until her body could resolve the problem for her. And I did not feel that that was an appropriate response to this very debilitating situation for her. In desperation, I went online and looked for holistic practitioners who could potentially treat shingles, and found Suzanne's name on a number of lists, and we ended up calling her for an appointment, and that's where things began. And with the first appointment, which lasted about a half hour, Suzanne was able to resolve pain to a level where my mother was able to tolerate it. And by the end of the third visit, her pain was completely gone. And within about 2 months, her shingles was completely gone.
Yeah, it was quite remarkable.
And we both found that it was a remarkable process. And the speed with which these energy techniques worked was absolutely astounding.
So a few years later, when your mother came down with cancer, you contacted me.
Again, we went to a top specialist, an oncological specialist. The only solution he had for her was a very brutal regimen of chemotherapy. And after checking with some friends of mine who are oncological nurses, I found that an 88-and-a-half-year-old going through such chemotherapy, that the chemo would most likely kill her, and fairly quickly. So we again sought Suzanne's help, and with great success, we were able to treat her using energy medicine. Suzanne was able to teach me a number of these techniques, which I was able to use at home on my own, because getting my mother back and forth in the physical condition she was in was difficult. And
she had a broken wrist.
Yeah, about halfway through the treatments, she had slipped and fallen one day and fractured her wrist, and that only compounded all the other existing problems. Yeah. So treatment at home was the way to do it, and I ended up treating her generally twice a day, and on sometimes 3 times a day, using Suzanne's techniques. And they worked very, very efficiently and effectively. Mm-hmm.
So, but at first you were a little nervous, right?
At first I was extremely nervous that
you thought I was the grand wizard, right?
Well, that a layperson could pull off any of the techniques that you were pulling off and have impact. Mm-hmm. And I learned very quickly that, in fact, a layperson who was properly taught and guided could, in fact, do these things and do it effectively. So, yes, it worked out very nicely.
Yeah. So, describe some of the difficulties you had.
Basically learning...
Because nobody believes you that you were able to... First of all, talk about the results. Like, what did your mother's tumor look like?
Well, at the start, the tumor occupied approximately the entire right half of her face, from the top of her right eyebrow down almost to her chin, and almost as far back as her right ear. Mm-hmm. So virtually the entire right half of her face was obliterated by this tumor. It stuck out from her face almost as far as the tip of her nose, so it was quite a massive tissue growth.
And it hurt, and
it was uncomfortable for her. She wasn't in a lot of pain, but she was in a lot of discomfort. Mm-hmm. And it forced her right lower lid up and actually covered her whole right eye, so she had no vision out of her right eye for the better part of 6 months.
Yeah, it was Merkel cell
Merkel cell carcinoma, which is a rare and very oops,
Mhm.
and very aggressive form of skin cancer.
Mhm.
And the rate at which the tumor grows with this type of cancer is absolutely mind-blowing.
Mhm. All right. So you learned this laying on of hands technique, right?
Yeah, I learned from you. I watched what you were doing in the office with my mom,
Mm-hmm.
and you actually coached me the first time at the office, and I learned how to do it. And it was a bit of a learning
I
curve
think I
because
trained you twice, right?
I-
I don't
you-
think it, maybe 3 times.
you trained me several times.
Uh-huh.
It took a while for,
Mm-hmm.
in spite of your skill and in spite of all of the
And your wonderful talent. It's still
direct approach with me, it took a while for it to catch on.
Mm-hmm.
It was learning how to trust my intuition,
Mm-hmm.
which I did eventually,
Mm-hmm.
and learning not to want to
But it
battle
wasn't really
the
your
cancer.
intuition. It was really feedback, right? It was
Well,
observation.
it was both. A lot of it was observational, yeah,
Mm-hmm.
and you had to become a very observant spectator.
Mm-hmm.
And it was learning when to apply these techniques and when to let go and stop applying them.
Mm-hmm.
Because if you apply them too much, it's almost as if nothing is being done. And if you don't apply them enough, it's almost as if nothing is being done. So you have to learn that fine line as how much treatment does it require each given time, which
Sort of
will
like
change.
watering a plant. You can
Yes.
over and underwater it.
Exactly.
Yeah.
Exactly. Yeah.
Although in my experience, it's hard to overwater with energy medicine, but it's just time consuming, and you
Yeah.
have a lot of other things
Yeah.
to do.
Yeah.
I don't think in my maybe in your experience, it was just you can't really hurt with energy medicine.
No, it was just getting used to something that I was unaccustomed to handling
Mm-hmm.
and learning my mother's cues as to when do I have to be a little more intense with the treatment and when can I be a little more reserved with the treatment. And that did take some time.
Mm-hmm. So on a good day, or like a day when treated when I train people to treat when the tumor's hot.
Yes.
When it's active.
Yes.
So when her tumor was very hot and active, how much time did you spend?
Oh, a treatment would take easily 15 to 20 minutes.
Mm-hmm.
A couple of times I think it took even closer to a half hour.
But not 2 or 3 hours.
No,
treatment.
no,
Uh-huh.
not at all.
Because sometimes I say, like 5 or 10 minute treatments.
Yeah.
So in your experience, they were 10
Yeah.
to 15, maybe 20 minutes.
Probably could have done it in the 10 minutes, but I generally would take about 15 to 20 minutes just because I felt more comfortable with it.
Mm-hmm. Mm-hmm.
And
Okay,
over time, I probably did it a little less than that,
Mhm.
but yeah,
okay.
for the first couple of months.
And
Anyway.
then when her tumor wasn't so hot, you just didn't have to do it.
When the tumor, felt really cool to the touch, I did very little.
Yeah.
And I found that by treating her when it was that cool to the touch, didn't seem to have much benefit at all.
Okay. All right. And how could you tell this is sort of like woo-woo, right? You kind of feels like magic.
If it was working.
How do you tell? Right during the treatment, what did you observe?
You can feel
before and after.
Well, you can feel a shift in the energy being generated by the tumor. You could actually feel it kind of diminish.
Mm-hmm.
It physically got cooler to the touch. And initially, when I would start to treat her, the tumor was a very hard mass. And with each successive treatment, the tumor would soften.
Mm-hmm.
And when the treatments went very well, the softening was dramatic. And when the treatments didn't go quite so well, it was a little less dramatic, but you could still feel softening
Mm-hmm. Mm-hmm.
before versus after the treatment.
But I think the first month you didn't see that much.
The first month, it was basically going on intuition more than anything else, because what I could see visibly was not a whole lot of change. I went by the verbal feedback my mom was giving me, and she felt things that I couldn't see at that point, or at least wasn't experienced enough to see. And as time went on, little subtle changes became much more apparent.
Mm-hmm. And I never know, what the outcome of these things are. And I
Yeah.
remember you asking me, it just became so apparent that even if it didn't completely cure her cancer, it was helping her. The treatments were therapeutic.
It was helping dramatically. It basically gave her a sense of empowerment in a very powerless situation.
Mm-hmm.
And that she felt within the first 2 or 3 treatments.
Yeah.
And if nothing else, I wanted to at least provide her with that.
Yeah. Yeah. Good. So, how do you tell us what other people thought? Your neighbors and the doctors and things like that.
At first, my neighbors, while they were supportive of us going this route, were extremely skeptical. As they watched the tumor grow initially.
And why were they supportive?
Well, they were supportive because of my mom's age and just, I guess, wanting to be supportive of her, that this is what she chose to do. I don't think that too many of them actually believed that this would work, but they weren't, gung-ho for going the chemo route, feeling that that would probably do more harm to her than what I was doing with her.
Okay.
As time went on, they could see changes, physical, visible changes in the tumor, and that's when their perceptions and their understanding of things changed dramatically. And they began to actually believe that not only was this possible, but they could see the changes. They could see the changes in my mother's demeanor and temperament and physical
and the tumor was
looks.
shrinking.
They could see the tumor shrinking visibly, and they figured that it had to have something to do with what I was doing with her and what you were doing with her.
Well, I was doing very little at the end. You were
At the end, it was almost entirely me.
Yeah. And so talk about what happened with her, like what happened to the tumor, and then
after about the first month, the tumor was visibly starting to shrink. At first, quite slowly. But the most incredible thing was that day to day, it was getting softer and softer and softer, so much that I could physically put my fingertip into it and press down almost to the bone underlying the skin on the face.
Really gushy.
Very gushy, yes. Yes. And initially it was quite hard and almost like a hockey puck.
Yeah.
So the change was dramatic.
And how far did it shrink?
The shrinking, I would say that by the time she passed, it had shrunk about 98 to 99% of what it originally was. It was the size of a quarter in diameter on her face, and it was flat to her face. So you almost couldn't even tell that it was a tumor anymore. Her doctors saw her in the interim. We had a cardiologist who we were going to every month or so. He and his staff were absolutely amazed at the changes and the progress and said they had never seen anything like it, even with somebody treated with conventional or chemo. They had never seen such dramatic changes. And our neighbors were equally as blown away by the changes, and they could see it. I mean, they could physically see the shrinkage and the diminution in the size of the tumor and its shape. And the fact that it was soft to the touch, which they knew initially it was very hard, and now it wasn't. And they were utterly amazed.
And talk about how she died.
She suffered a silent heart attack one evening at home, out of the blue. No warning signs, no symptoms. We got the paramedics there extremely quickly, and they just were unable to revive her. So she left. She went peacefully. She was not in pain. And I'm convinced that the energy treatments helped her with that, because without that, I think she would have had a very painful death.
Yeah, it would have been just a horror story.
And possibly lingering, unfortunately.
As it was, both of you went into that transition feeling empowered and
absolutely, yes.
And like
yes.
We don't have control over the big things like
no.
like when we go. But
I think cancer is one diagnosis that most people are absolutely blown away by, because you are so powerless in anything that's done to treat it.
Yeah. So how did this? How did you feel? First of all, you're still mourning your mother's death.
Yeah.
And but she sort of left a legacy with this, and like in you.
Well,
how did it change you as a caregiver?
Showing me what is possible as a caregiver. That even little things can have some very dramatic impacts on the life of somebody who is suffering as she was. Her suffering diminished tremendously as the treatments progressed, which was helpful. It gave her the ability to not have to constantly focus on her tumor or what it was doing to her, because it gave her back a somewhat of a sense of living with the tumor, and many people never get that opportunity.
Yeah.
So I was thankful for that.
What about for you?
It showed me that I could trust intuitive senses without questioning or thinking twice about it. And it showed me that by tuning into these things, I think that we all have these capabilities. It's just a matter of tuning into them and learning how to use them. I think we are all innate healers. We just don't realize it.
Yeah. I was super excited with your results because although I've helped people with cancer a lot, my goal is to train people.
Right.
Because it takes,
Right.
in my method, you have to sort of work with the tumor. And
Yes.
it's inconvenient. You wouldn't have been able to pop over 3 times a day.
Exactly. Exactly.
Even if it was easy to get her in and out.
Yeah,
all
no,
it's just like,
definitely was the case.
just to sit there while they're eating breakfast or a little bit after, just
Yep.
to give a little
Yep.
burst of energy treatment.
Well, it was also nice that if I would come in on her during the day, no matter what time of the day it was, and she needed a treatment, I mean, it was so easy to do. And after a while, it became second nature. And I let the sensations that I got through my hands guide me as to how to tailor each session with her, and that helped dramatically over time.
So you went from feeling like sort of like a klutz, probably.
Well, I went from being almost detached from the process to actually embracing the process and understanding what it is I was doing, and that made it a lot easier to do.
And talk about how your view of a tumor changed. Like going from beating cancer to...
Well, rather than beating it up or going into the boxing ring and doing the 1-2 knockout punch, which the tumor will not only resist but will actually fight back harder, if you learn to embrace it and you learn not to fear it, anything is possible.
Yeah.
And I think this would be with any kind of cancer, with anyone young or old. And even if you have pets that have cancer, I'm sure that you could apply these techniques equally as successfully.
Yeah, and when I'm treating tumors, it's almost like I'm just being present with their cells that are sort of run amok.
That's exactly right.
But you're just sort of
That's
there in a compassionate, open-hearted way.
Once you stop being judgmental towards the tumor, which took me a while.
And you're not really judging it as good either.
No. You're very neutral.
Neutral.
You're being there. You're allowing it to exist. You're allowing it to coexist with you. And once you can get to that point, a lot of this stuff really kicks in and kicks in nicely.
And my sense is that it was your mother doing the healing.
Oh, without a doubt.
You weren't like the great healer.
No. I was just helping her body to do what it was capable of doing from the start. And just kind of guiding her and it to do that job.
Right, and so you were like a little catalyst, but it's just, so all right, great.
I was little more than an on-the-scene coach.
Yeah.
And that's
like,
it.
Try, to hear
That's
that.
it. You're not as active a participant as I thought you were when I initially started this, and the more I got into the mode of just being there as the coach, the better the treatments were and the easier it was to do them.
Yeah, less draining. It got like profoundly simple. It's scary simple.
It was amazing how simple it was, and it took about a month and a half to kindly get that, and I had the aha moment. And once I had that aha moment as to how simple it was amazing how well everything went and flowed. And I got that from feedback from my mother as well.
Yeah.
So.
And that relates to anything else we get good at. If something turns and you just you keep it simple and you just do it. Yeah.
But rather than being concerned about, am I doing a 5-minute or a 10-minute treatment?
Or where am I holding the right spot?
Am I holding it, enough? Am I close enough? Am I using enough intensity? When you can let go of all that, the treatments will kind of tell you what you need to do and for how long. And it was amazing how simple that became once I stumbled upon that.
Yeah. So there was a little bit of a learning curve.
A big learning curve for me initially, yes. and I thought I would get this very quickly, and it didn't quite work out that way.
But you did really well. I think I only had 3 coaching sessions with you.
Yep.
That's like very little coaching.
But I thought I would learn it in 1, and it took 2 more follow-ups after that for it to be effective. I think that our impression of what this is and how it works and how it actually is, I think, are 2 very different things. And once you can learn to distinguish the 2, this really becomes easy.
Okay, good. Yeah. So what would you say to someone who maybe has a pet with cancer or has a loved one with cancer, and the doctors don't really have anything to offer.
I would say to seek the advice of someone like Suzanne, who can educate you as to what is possible, how this can be done, and then try it. You've got nothing to lose. Conventional medicine treating this stuff has a very limited success rate, and often, even when it is successful, the patient is lost. This will not have that outcome, and for whatever time you can give the patient, at least they won't be suffering, and you'll actually improve their quality of life and yours in the process. And I think it's worth anybody trying this, because it's not difficult to do.
Yeah. Now, do you feel like you're sort of like Superman now, or you just feel like yourself?
Not at all. It's what
you
I
sort of cured cancer. I mean, it wasn't documented because
yes.
we were waiting for the little quarter thing to go away, and then we were going to do all that, and then she died of a heart attack.
Do I feel like Superman? No. I just feel like I learned how to tune in to these wonderful gifts that we all have, and few of us, I think, ever realize we can use them. Or how to use them.
Yeah. Yeah, and they're simple. You just need a little bit of guidance, I think.
It's a little bit of guidance from somebody like yourself who is fully immersed in this. And it's amazing what's possible once you have a little guidance with this stuff, because it is very powerful. The feedback that you will get, even from pets, you will absolutely, after the first treatment, get a good understanding of what you're doing and how to do it, and you'll be amazed at what can be done. And I know that because I worked on Suzanne's Sheltie before she passed, and we were able to do some very successful stuff with her, and the feedback was almost immediate with each treatment.
Yeah. The energy is not that subtle.
No.
It's not. You can actually feel it with your hands, and you look at it with your eyes. You don't need extra sensory
And
perception.
you may feel it even more intensely working on a pet than you will a person, because the pets are much more open to this from the get-go. Whereas the human patients, and even in my mom's case, not that she ever doubted this, but she was very skeptical that, first of all, that she had
very skeptical.
Well, that she had any part in this, that it was all either Suzanne doing the work or me doing the work. And in fact, all we were doing was guiding her body as to which path to take, and that's it. And in time, my mother was able to perceive that and acknowledge it. But it took months. It took many months.
She had this sense like you go to the healer.
Right.
And that's not exactly how it works.
And the person who was involved in this can't possibly be a component of the healing. It's the outsiders that are doing all the healing. And that's
not the way it is.
That's furthest from the truth.
Yeah. All right. Well, very good. So, thank you for sharing this. So,
You're very welcome.
If the viewer, if you want to learn more about my work, you can go to spiritgate.com, and there's a cancer tab up at the top, where you can have a complimentary get acquainted call with me. I only accept people I think I can help, and we assess that for free, and we go from there. So thank you, Jonathan.
You're very welcome. I hope others who view this will benefit from this, because there are many things we can do. Conventional medicine has taught us that there are limitations to everything. And I got to tell you, folks, those limitations for the most part don't exist. Those are in our mind. And if we believe it hard enough, yes, we will limit ourselves as to what's possible. I've been through this. My mother was through it. Suzanne went through it with us. And I got to tell you, this stuff works, and it works powerfully.
Oh, so you actually had to break down some of your beliefs in order to
absolutely
get through this.
Without a doubt. Not that I ever doubted this or these techniques, but this is so foreign to what I had learned as to what was possible, and the maximum of what is possible. And we limit ourselves in medicine, in this country anyway, on lots of things. Cancer is one of the biggest. And, there are other possibilities out there that do work and do work well. And if nothing else, you're going to give the person suffering from this a much better quality of life for whatever time frame they have.
So your mother didn't really believe in it, yet she responded to it.
Exactly.
Right. And you didn't really believe in it.
It took many months for me to fully appreciate and understand what was going on.
And yet you were being effective during that time.
Yes.
Okay, because I like to tell people that it's really more about observation than about belief.
It is.
And the belief that I
It is.
like you to worry about is not belief in me or the method, but belief in the limitations.
Yep.
And just, it's not that you don't have to believe in any limitation, you just have to like feel that maybe there's something here that you don't know, and like
Yeah.
be open with a question mark of like,
Well,
I wonder what's possible
I
here.
think if you trust that anything is possible, that will eliminate a lot of the preconceived limits that you would otherwise put on yourself, and that the patient who's going through this would put on themselves.
So now I tell people it's okay to have limits to what you think is possible. Like, you might not think this is possible, but can you leave it open as a question? Like, I wonder if we do this,
Yeah.
I wonder if we do this, what will happen?
Yeah.
And then we'll observe if anything's happening. Because my sense is that if you didn't get any feedback, you wouldn't have kept doing it.
No, probably not.
You would have petered out and said, never mind.
Yeah.
And that's where a coach comes in, because sometimes people give up before they realize, oh, there's this little tweaky thing that you can do, and it all starts working. So, yeah, that's part of my coaching, is like this whole, what do you do with your mind while you're putting your hands on people, and working with that. So anyway, that's enough for today. Thanks again, and yeah, all right, bye-bye.